If you're listening to this podcast on YouTube, for a better experience, switch to the video version. The link is in the top right corner of the video and in the episode description. Hello and welcome, I'm Fernando, a GP in the UK. Today we're going to talk about the increasing number of ADHD diagnoses, especially in adults, always focusing on what is relevant in primary care only. I have based this episode on a number of published medical articles. The links to them are in the episode description. Right, let's jump into it. And the first question to ask is, why are we covering this topic now? You may be aware that in the UK, the government has recently announced a formal review into surgeon mental health and neurodevelopment diagnoses, including ADHD and autism. This has sparked media coverage and public debate. Are we seeing a real increase in ADHD, or are normal struggles being unnecessarily medicalized? In other words, is this an epidemic of overdiagnosis, or does the rising case simply reflect that we're starting to catch up with reality? So now it's more important than ever to look at what the research actually shows, especially around adult ADHD diagnosis. And although we in primary care are not directly responsible for the full diagnosis and treatment process, the way we assess and support these patients at their first point of contact can make a huge difference. It shapes how they experience their care, whether they feel understood, and whether they receive the guidance and support they need. Let's start by reminding ourselves that attention deficit hyperactivity disorder, or ADHD, is a neurodevelopmental condition that affects a person's ability to regulate attention, manage impulses, and maintain consistent levels of activity. In adults, ADHD often looks very different from the stereotype of a hyperactive child. Adults tend to present with chronic distractibility, difficulty organizing tasks, emotional impulsivity, forgetfulness, restlessness, and problems sustaining attention at work or in relationships. These symptoms can have real consequences, including difficulties with work and relationships, financial problems, and a persistent sense of underachievement. The consensus is that ADHD is highly heritable and is associated with higher rates of anxiety, depression, and substance misuse. It's also linked to measurable differences in executive brain function. And by this, we mean that the prefrontal cortex, the area responsible for focus, planning, impulse control, and emotional regulation, works differently in people with ADHD. Brain imaging studies have repeatedly shown altered activity in this area. So what this really means is that ADHD symptoms aren't just behavioral. They reflect real differences in brain function. Importantly, ADHD is not a condition people usually grow out of. For around 2/3 of children with ADHD, symptoms continue into adulthood, although sometimes in a more subtle or internalized form. So why are adult ADHD diagnoses increasing? Research shows that adult ADHD is now better recognized. Historically, many adults, especially women, were simply missed in childhood because their symptoms were less disruptive or because diagnostic criteria were focused on school performance rather than adults functioning. A recent study from the UK found that adults' referrals for ADHD assessment increased threefold between 2019 and 2023, with peaks during and after the COVID-19 pandemic. This is likely because the pandemic disrupted daily routines and removed coping structures, making previously manageable symptoms more difficult and prompting more adults to seek help. As diagnoses have increased, some people, including medical professionals, have expressed concerns that the condition might be overdiagnosed. After all, clinicians have always been very wary of patients self-diagnosing, and the fact that some ADHD assessments rely on self-reported symptoms can create doubt for those who aren't familiar with how structured and evidence-based these assessments actually are. The numbers are stark. A large 20-year UK primary care study found that recorded ADHD diagnoses increased roughly 20-fold, while ADHD medication prescribing rose 50-fold. Some of the biggest proportional increases were seen in adults, particularly men aged 18 to 29. Is this surprising? Not necessarily. ADHD is more common than many people realize. Multiple published reviews estimate the prevalence in children and adolescents to be between 2 and 8%. And a major 2023 reanalysis placed it at 5.41%. However, many studies showing steep increases in diagnosis have still reported prevalence rates well below this expected 5%, and often well below 2%. Additionally, the most recent adult psychiatric morbidity survey shows that in England, although 13.9% of adults screened positive for probable ADHD, only 1.8% reported receiving informal diagnosis. That suggests that many adults with ADHD still remain unidentified. So, while there may be some isolated overdiagnosis, overall the evidence suggests that ADHD remains underdiagnosed, particularly in adults. What about internationally? Have there been similar rises across other Western countries? And the short answer is yes. Across Europe and other high-income countries, studies consistently show that ADHD medication use among adults has grown sharply, often by several 100% over the last decade, with a particularly striking rise in adult women. And a recent analysis in the United States showed that 6% of adults report a current ADHD diagnosis, and importantly, about half of them were first diagnosed in adulthood. This increase in diagnosis may simply reflect that we're catching up with the reality of neurodivergence. Factors contributing to this better recognition include greater understanding that ADHD persists into adulthood, the use of more adult-appropriate diagnostic criteria, and higher public awareness with reduced stigma. What does an ADHD diagnosis actually mean for patients? For many adults, receiving a diagnosis finally helps them make sense of lifelong challenges. And research consistently shows that after diagnosis, people often experience improved self-esteem, better workplace functioning, more stable relationships, and a reduced risk of comorbid anxiety and depression. It also gives them the opportunity to seek treatment. Treatment for ADHD is multimodal and includes education and coaching, CBT, lifestyle structuring, and when appropriate, medication, which remains one of the most effective interventions for ADHD symptoms in adults. By the way, if you want to learn more about ADHD treatment options, stay tuned. A full video on ADHD treatment is coming soon. So that is it, a review of the increased number of ADHD diagnoses. We have come to the end of this episode. Remember that this is not medical advice, but only my summary and my interpretation of the guidelines. You must always use your clinical judgment. Thank you for listening, and goodbye.